Hello and welcome to the next Saviours Essential Question Series for NEET PG 2025. Here we discuss the most likely questions that are likely to be asked in 2025 NEET PG sessions. And today we are presenting with or discussing a very important question, which is almost we are sure that it would be presented to you in this year examination also, and that is on the basis of the glomerular diseases. Now, how the examiner used to construct this question, in the first line itself, he wants you to identify whether the patient is suffering from this nephrotic syndrome or nephritic syndrome. And on the basis of that clinical presentation in the first line, you will be coming to know that if the proteinuria is there, massive proteinuria is there, if there is hypoalbuminemia, if there is periorbital or pedal edema, if there is hyperlipidemia, then the patient is suffering probably from the nephrotic syndrome. And among the options, what you have to search for is the minimal change disease, the FSGS, the membranous nephropathy, or the diabetic nephropathy, because all of them are presenting with the features of the nephrotic syndrome. On the other hand, if there are features like hematuria, if there is a feature like hypertension, if there is a feature like oliguria, or if there is a feature like mild proteinuria, then probably the question is asking about the nephritic syndrome and what are the common options which are usually provided related to this is the post streptococcal glomerulonephritis or the IgA nephropathy or RPGN, that is rapidly progressive glomerulonephritis, or the lupus nephritis. So this is how the first phase of the question goes. Now let's check the question, how the question is asked. You see, a 30-year-old male presents to the nephrology clinic with the progressive swelling of the leg and face over the past 2 weeks. There is no fever, hematuria, or recent throat or skin infection. So that means to some extent we have almost ruled out that nephritic syndrome features. Now he reports mild fatigue, no significant weight loss, past history is unremarkable, does not take any medications as far as examinations are concerned, normal BP, normal heart rate, normal temperature, periorbital puffiness, bilateral pedal edema. So here we are almost sure that the patient is suffering from nephrotic syndrome. Abdominal examination, mild distension, and cardiopulmonary examination is absolutely normal. Now, further digging up in the laboratory investigations, you will find that there is massive proteinuria but no RBCs or RBC cast. So on the basis of which we have almost ruled out the possibility of IgA nephropathy. Now, what next that we have to look for is the serum albumin, which is obviously low, the cholesterol levels are high, creatinine is relatively normal, and the complements level are also normal. And you will come to know why this complement level is given, so that to rule out one of the options out. And ANA and anti-DS DNA is also negative. As far as renal biopsy findings are concerned, light microscopy and immunofluorescence are absolutely normal, but electron microscopic findings, diffuse podocyte foot process effacement. And you know that when this line, this term, diffuse podocyte foot process effacement is presented to you, then the answer for that question is straightforward, that is minimal change disease. But here we are here to discuss the approach, that how to diagnose any condition which is related to this topic, that is glomerular diseases. So before jumping on to the answers, let's deal with the options first, right? So as you can very clearly see that the patient over here is presenting with the features of the nephrotic syndrome, and these are the features which are present. So this is one thing which is already clear. Now the second point is, you see the main clue in this case, that the renal biopsy findings, it shows the normal light microscopy and the podocyte foot process effacement on electron microscopy, which is characteristic of minimal change disease. As far as other information in the question is concerned, that no immune deposits on immunofluorescence, it differentiate it from immune mediated glomerular diseases. Like normal serum complement levels also help us to rule out the lupus nephritis and post glomerular nephritis. And you already know that one thing that you should be knowing, because you have already reached the answer of MCD, that MCD, it responds dramatically to prednisolone, right? As far as management of the MCD is concerned. Now, another, like before marking the correct answer out, you have to consolidate your answer. So let's rule out, let's get confident that other options are incorrect. You see, although the focal segmental glomerulosclerosis, it presents almost similar to that of the nephrotic syndrome, but the light microscopy findings shows focal and segmental sclerosis of the glomeruli, all right, which is absent obviously over here. And it is found to be more common in immunocompromised individuals or those who are associated with hypertension, obesity, and HIV. And steroid resistant, these cases are particularly steroid resistant. Unlike the minimal change disease where we have discussed, they are highly sensitive to prednisolone. So this option is ruled out. Now, membranous nephropathy, as we just now came to know about, that the most common cause of nephritic syndrome in adults is actually the membranous nephropathy. But here, the light microscopy findings show thickened glomerular basement membrane. The immunofluorescence shows granular IgG and C3 deposits along the glomerular basement membrane, and the electron microscopy shows subepithelial immune deposits, which is a spike and dome pattern, which is obviously absent here in the question. So this option can easily be ruled out. But remember one point, that this membranous nephropathy is actually the commonest cause of nephrotic syndromes in case of adults. As far as IgA nephropathy or the Buzzard disease is concerned, we have already ruled out because it is a nephritic syndrome. So there has to be a presence of gross hematuria following upper respiratory tract infection, which is absent in this question. Microscopic hematuria and the RBC casts are common. Light microscopy shows mesangial proliferation, and the immunofluorescence shows IgA deposits in the mesangium. So these are the characteristic finding for these particular uh, diseases, which are also discussed here, so that it helps you to rule out that what exactly is the answer for this particular one or for this particular question. You see, one thing that all of you must be aware of is that how to approach a glomerular disease related question. The first point obviously is the differentiation of the nephrotic versus nephritic syndrome, which is based on the clinical features mentioned in the question in the form of proteinuria, hematuria, blood pressure, and periorbital edema. Right now, another point is that there will be a provision of a unique finding for each disease. Like for post streptococcal glomerulonephritis, there will be humps, MCD, foot process effacement, FSGS, the segmental, MN, spike and dome pattern, IgA, mesangial IgA deposit. So this is something that you already are aware of, right? This is not new. Then urine analysis will always be provided to you. Serology and renal biopsy are the key findings in order to make you reach the answer for that particular question. And the management of the disease, management is disease specific, right? Like as we have discussed, prednisolone or the steroids in case of MCD, ACE inhibitors in case of IgA, plasmapheresis in case of good pasture syndrome. So this is how you have to approach the glomerular disease related question. We think that this is a sort of an important topic where the examiner specifically asks you by giving the clinical picture, and then the answer is reached by ruling the other option out. In the next session, we'll be talking about the real approach of dealing with the glomerular diseases. Till then, all the best. Thank you. Prepare well. If you have any query, any questions, then we are sharing a Telegram group link. Be the part of it and don't miss any update. Thank you so much.